I'd like to talk about this title. Recent studies have suggested an association between excessive increase in oxidative stress and rats, especially OAB. Some researchers reported that mechanism of action of tadalafil might reduce oxidative stress in OAB patients. We aim to examine the change in OAB symptoms and oxidative stress with tadalafil monotherapy and assess their association in male rat patients. This 12-week prospective study was performed at a single institution. We targeted the newly male patient who met the criteria for OAB. We already administered tadalafil at 5 mg once daily to the patient and evaluated the symptoms before and after 12-week tadalafil monotherapy. The OABSS and the IPSS were used for the endpoint of subjective symptoms, and objective findings were evaluated using urofilmetry and post-void residual urine. In addition, the changes in oxidative stress was evaluated using urinary 8-hydroxydeoxyguanosine level. We got the patient first morning urine sample to evaluate it using ELISA kit, and the urinary 8-hydroxydeoxyguanosine level was adjusted for urinary creatinine levels. 29 patients enrolled in the study, and the mean age was 71.6 years old. All items of OABSS, total OABSS, and almost all items of IPSS, total score, total IPSS, and the QOL score improved after tadalafil monotherapy. In the objective finding, the body volume and the maximum flow rate improved after tadalafil monotherapy. However, post-void residual urine did not show the significant improvement after treatment. Both of 8-hydroxydeoxyguanosine level and urinary 8-hydroxydeoxyguanosine creatinine ratio level decreased after tadalafil monotherapy. Furthermore, in responder who showed the improvement of OAB symptoms and did not meet the criteria for overactive bladder, the urinary 8-hydroxydeoxyguanosine creatinine ratio decreased significantly decreased after treatment. However, responder group, the urinary 8-hydroxydeoxyguanosine creatinine level did not show the significant differences. So tadalafil monotherapy improved both of subjective and objective OAB symptoms, and tadalafil treatment decreased the level of oxidative stress in the study. Furthermore, the improvement of OAB symptoms correlated to the decreasing of the level of oxidative stress. So our conclusion is that tadalafil administration treatment may improve rats, including OAB, by reducing oxidative stress in male patients. Thank you.
Thank you. All the placebo-controlled studies with PDE inhibitors have shown that it does not increase Qmax above the level of placebo. In your study, there was quite a considerable increase in the absence of placebo, indicating that this may be a placebo effect. So if this is a placebo effect, how do you know that some of the other effects you observed were not placebo effects?
Thank you very much. I agree your comment, and we did not set in the study a placebo control group, and however, in our study, the patient group who is patient exclude over 30 milligram of percent volume. We exclude. So this is we include the severe. We didn't include the severity patient. Maybe.
Presumably, are you postulating that this is due to increased blood flow and vasodilation? And if so, would it work in the female? I mean, theoretically, if these results aren't placebo, would it work in the female as well?
Yes, thank you. Your question. In this study, we evaluated blood perfusion using blood perfusion. However, another group who suggested that using the male diabetes mellitus model or animal model, they suggested that the improvement of vasodilation and improvement of blood perfusion or improve perfusion due to the tadalafil improve urinary function.
Gotcha. Thank you.